Culturally competent nursing care for European Americans. European Americans, also referred to as Caucasians and whites, are people of European ancestry that include various ethnicities and nationalities, such as English, Scottish, Welsh, Irish, French, German, Italian, Greek, Polish, Russian, and more. The primary language of most European Americans is English. Throughout the United States, there are various American English dialects, such as the Appalachian dialect, and some nurses may have difficulty understanding their patients. European immigrants may not speak English fluently or know English. Use a certified interpreter to communicate with patients who do not know English or if English is not their primary language. The predominant religion practiced by European Americans is Christianity. However, there are many that follow other religions, such as Judaism, or be non-religious. Ask the patient if he or she has any religious considerations to healthcare. Most European Americans follow the biomedical health model of understanding health and illness. According to the biomedical health model, life is controlled by physical and biochemical processes that can be manipulated by humans. This model is heavily rooted in modern understanding of Western science and medicine. However, there may be some European American patients that follow the magico-religious health model, which claims that health and illness are controlled by supernatural forces, such as the will of God or magic. Many white Americans who live in the South and Appalachia follow folk medicine that has roots in Celtic, West African, and Native American practices. Examples of Appalachian and Southern folk medicine include using butter to treat burns, using the blood of a black rooster to treat shingles, and reciting a verse from the biblical book of Isaiah to stop bleeding. Ask the patient if he or she uses herbal remedies and traditional healing methods to determine possible drug contraindications. Western tradition and European American culture has its roots in Greco-Roman culture, Judeo-Christian religious traditions, and the scientific and philosophical thought from the Renaissance and the Enlightenment. Key elements of European American culture include independence, individualism, materialism, and self-reliance. Different European ethnic groups have differing cultural practices that may affect their views on healthcare and disease. For example, some Italian Americans believe that bad luck can be spread by giving someone the evil eye, and they may perform the tarantella, a fast, upbeat dance style accompanied by tambourines, because they believe the dance can remove spider venom from the body of the dancer. Be sure to ask the patient about specific cultural beliefs. Avoid using European American stereotypes such as all white Southerners are racist, or that all Italian Americans have a connection to the mafia.